Welcome back, everybody. It goes without saying, but parenting is hard. It always has been. But on top of the normal, natural challenges parents face when raising children, here in the U.S., we have the added burden of talking to our kids about mass shootings and school shootings. It's not easy, and you may not even want to do it at all. But depending on the age of your child, chances are they're going to hear about it, whether you talk to them or not. We want to talk about how you as the parent can reassure and help your kids process these events that you ourselves can barely comprehend. And to do that, we're going to bring in psychiatrist Dr. Carole Lieberman to talk to us about how we can process our own emotions first and then translate that we've learned to our kids. Welcome, doctor. Let's talk about ages first. I have a 4-year-old and a 7-year-old. Is there even a right time to bring all of this up, or is it just a very difficult judgment call for all of us?
Well, it does depend in part upon the age, but also upon the psychological maturity of the child. But what you were saying at the beginning was right, that really kids, certainly any child that goes to school, even preschool, is going to hear about this. Or a child who has an older sibling and he may hear them talking about it. So parents have to just go from, and of course they, go into the television, the internet and so on. So parents have to assume that kids are going to hear something about it. And if they don't talk to them about it, kids are going to, take away all kinds of confusing messages and are going to be more frightened and are going to stuff their feelings down. If it makes them feel scared, sad, mad, or bad meaning a mixture of feelings, they're going to stuff these feelings down, and it's going to come out in other ways that are not healthy.
Mm-hmm. So once you've made that decision as a parent that you are going to talk to them about it, how do you go about doing that? How do you even start that conversation, doctor?
Well, you can start by using either the internet or television to, something that they've seen, or have you heard about some kind of problem in a school? You can start very, naturally. And if they say no, then you still might want to, depending upon their age and so on, you still might want to talk about it. Well, a bad thing happened at this school, and it's really sad. But the thing is, what parents need to talk to their kids about also is getting the kids to talk to them about their feelings about life in general. In other words, not just their feelings about what happened at the school shooting, but the ideal parent would have developed, and if not yet, can now develop a close relationship with their children so that their children will tell them about their feelings in general. Are they feeling bullied at school? Are they feeling ashamed? Are they feeling angry? All kinds, resentful, all kinds of feelings, and then to get the child to talk about these feelings at whatever, however they can talk about it, whatever age level they can talk about it on, or even get them to draw and ask them questions about their drawings. But all these school shooters, it is not just about the guns. I mean, guns seems to be the quick and easy thing to talk about when they happen. But really, if you look at all the school shootings, the one in Texas, for example, his father wasn't in the picture. His mother was totally clueless as to what was going on with him. His grandmother, he shot her, so clearly that wasn't a great relationship. It really primarily has to do with the relationships in the family. And that is what you need to create a safe nest and a warm nest for kids.
Now, doctor, yeah, as you mentioned, it's very important to have that relationship, pre-existing relationship, so that when you get to this point, you can have an easier time with the conversation. But what about us, doctor, the parents? It seems like one of those situations where you put your own mask on in the airplane first so that you can help your kids. How do we go about protecting ourselves?
Yes, it's true. Certainly this is affecting all parents because you put yourself in the place of the parents who are grieving right now, and how they didn't expect when they sent their kid to school that this was going to happen. And one of the things is really this should stimulate parents. The thing to do when you're feeling helpless and hopeless about something is to take action and to do something about it. And creating the nests, you can even, of course, being involved in the PTA, trying to make things safer in the school. That those are some of the important kinds of things to also you can talk to your kids about recognizing when there are children in your class. It's the children in the class who are the potential future school shooters, who are either bullied or are isolated, like the kid in Texas was isolated. Sometimes they go hand in hand. And so you can give children the power to talk to their, first of all, to not bully any child or isolate any child, but to talk to a teacher if you think that there is a problem with a child. These things, mental illness needs to be detected sooner. For example, the mother of the Texas shooter was saying, oh, well, I thought he was just a loner. Well, if somebody is a loner, it often reflects some kind of mental illness. And if you get them treatment or even just get them to an evaluation right away, that can stop the majority of these shooters. The same thing with the guy in Buffalo. He was brought to a psychiatric facility because a year ago he told his teacher in front of the class that what he wanted to do after graduation was to do a mass shooting, like at a graduation. And so they called the police, and the police took him to a psychiatric facility where he stayed for about a day and a half, and then they released him. And apparently the parents didn't make him continue in therapy, and there we have it. And they were just oblivious to what was going on in his bedroom.
Yeah, it's certainly a lot to consider and some good advice for the parents. Dr. Lieberman, thank you so much for spreading that message with us today.
Thank you.